Welcome.
Welcome.
Subscribe
Subscribe.
and turn on the notification.
Turn on notification. And new welcome. Turn on new welcome. New welcome. New welcome.
Welcome. You have heard the introduction. Yes, he's very fond of the channel. Yeah, so today we are going to talk about cold feet and cold hands. If you've ever wondered why do you experience that, is it something you should be scared of? Is it something that you should be checked if it's too much? So if you have any pre-existing conditions, that might be the cause, and how you can handle it, and if it's too much, what are the signs you're supposed to look for, and from there, where do you go? Okay, I hope this video helps you and you are able to know the what ifs. So one of the causes of having cold feet or hands, first of all, this is a condition that it's not a condition, it's a disease that's called rhedosis. I don't know that word. I can't pronounce it. I'll put it here. It's called that disease, syndrome, or pneumonia. And some of the causes of it are working in cold environments. So let's say for example, when you're working in a cold environment, let's say putting stuff in the freezer all day, that's your work, you can develop that. Another thing is hunting, mountain climbing, if that's your job or hobby. Yeah, so those are some of the causes. So that's not too serious. What you can do to handle that as of that time is just making sure if you need to go into the freezer, you have your gloves on, really warm gloves or mittens, to take whatever you need to take. Exercise a lot, it helps with the blood flow. Actually, it's all about blood flow. Exercise a lot, make sure you have warm drinks. When you feel it's too much, when you feel your hands are too cold, have warm drinks. Another thing, you can use heat pads or warm bottles. They are ones that you use for the periods. You can use those ones to put on your back, to enable the circulation to go to your feet. You can put on socks, really warm socks. You can put on, what else? Anything that will make your body warm. Yeah. Another thing is anemia. So fewer healthy and properly functioning red blood cells than normal. Iron deficiency is the usual cause. So what can you do if you're sure this is the cause of having cold feet or hands? First of all, make sure you get a blood test. There are a lot of you can go to the hospital and ask for a blood test to test your iron efficiency, and then from there it's easy to know if it's the cause. What you can do is eat foods that are rich in iron, and just eat foods that are very rich in iron, and you can see this thing just reclining. Yeah. Another thing, this is a serious, and I hope I don't scare anyone, but it's good to just be in the know. Arterial disease. So what this is when your arteries are narrowed or dysfunctional. It reduces blood flow to your legs and feet and hands. So we have two types of arterial diseases. We have PAD, which is parallel artery disease. This affects 1/3 of people over 50 years who have diabetes. This causes arterial wall damage in the lower extremities when buildup of the plaque of the blood vessel walls. Some of the symptoms to know, these are some of the symptoms. If you have these symptoms and then you're experiencing cold feet, I think the best thing you can do, since we are not heart experts, you just go and explain it to your doctor and then get your tests done from there, and you can be sure when it's known early, it's just like cancer. When you find out early, it's easy to treat and to manage. Some of the symptoms of PAD are pain in the legs when exercising, numbness or pins and needles in your legs or feet, soreness on your legs and feet that heal very slow. So and we have another arterial disease which is called primary pulmonary hypertension. This damages the arteries of the lungs. Some of the symptoms of this primary pulmonary hypertension include dizziness, fatigue, and difficulty in breathing. So if you experience any of these symptoms and you have cold feet or cold legs and hands, you should definitely check in with the doctor and just know what's really going on and what they can help you to do. The next cause is diabetes. Diabetes, the symptoms include poor blood circulation, heart disease, or nerve damage. The solution in this is just keep your blood sugar levels steady. And by diabetes is something that you're sure of, and you're sure of these things that I'm talking about. So the only solution that you can have is keeping your blood sugar level steady and as close to normal as possible. If you have nerve damage, check your feet carefully for wounds that might not be felt but could be infected. This is something that I have seen, that there's some people who suffer with diabetes and their feet develop wounds that they can't feel, and this is something to do with the nerve damage. So it's really hard for you to know if you're sick or it's just a wound that's infected. So if you're not sure about what you're experiencing, if you're experiencing these symptoms, if you're not sure the kind of diabetes you're suffering from and what do I call them, some of the things that might be hindering or might be making you develop maybe the wounds and you can't feel them, it's good to talk to your doctor, and it's good to really ask for details, because what this does, it enables you to be more aware of what you're dealing with, and it's really easy to manage if you know what you're dealing with. Another thing is smoking. I have talked about smoking a lot on this channel, and I'll link up some of the ways, if you're trying to quit smoking, how you can be able to manage to quit smoking. I'll link up the video here or on the description. You can find the link to that. So smoking tobacco causes injury to your blood vessels throughout the body. they're specifically saying tobacco. So over time, this can damage the blood cells in your heart, making it harder to pump blood through your body. So what can you do about this? Quit smoking, going to therapy, and talking about how you're feeling. If what you're feeling is leading you to smoking, it's a good thing to go to therapy. And you can install, there are lots. As of the moment, technology is really good for now. We have lots of apps that can help monitor your own progress. How good is that? Yeah. We have a vitamin B12 deficiency. So this is all about healthy blood cells, which can be found by drinking in dairy products. Some of the symptoms include numbness, tingling sensation on your feet or your hands, fatigue, movement, and balance problems. You can't be able to balance even your own body. Mouth soreness and cold feet. Yeah. So what is the solution for this? First things first, you must be blood tested, and if the doctor assures you this is what you're actually suffering from, one of the things you have to do is change your diet or take supplements. And there are some injection that can be administered to be able to get the healthy blood cells back strong. Another thing is hypothyroidism. It's all about thyroid. Thyroidism, okay, is a condition where your thyroid is underactive and doesn't produce enough thyroid hormones to keep your body's metabolic functions properly running. Affects women more than men and is common over 60 years. You see why women, we must be really cautious of our health? It's because most of these things affect women more. We are very strong creatures actually, because by 60 you have already carried your pregnancies, or you have accomplished lots of tasks in your life. Women empowerment. And when it gets to this point, the best thing you can do is just keep on going, but just be really cautious of your health, whatever you're taking in, if it's gonna help you and how it's gonna help you. Yeah, so some of the symptoms include fatigue, joint pain, stiffness, dry skin, thinning hair, and depression. With these symptoms, I think it's really easy to know if you're suffering from this condition. And obvious, the next step you can take is just go to the doctor and explain the symptoms and then get tested. And from there, they'll give you the right medication that you need to be taking in. Yeah, so other causes include bacterial or viral infections, anxiety. When you have an anxiety attack, you can experience the cold feet and the cold hands. We have chronic indigestion, and we have painful periods too. Yeah, so I hope you have learned something new about the causes of having cold feet or hands, and how you can be able to manage it. So if you don't have any of those symptoms, the best thing you can do is just making sure when you're in the house and you feel your feet will get cold, put on sandals and socks on and leave it, and you're gonna be okay. Yeah, so I hope you have enjoyed and have learned something new. I'll see you guys on the next video. Let's see if our MC is ready to tell us goodbye. Okay, say bye guys.
Bye guys.
Thank you for watching.
Thank you for watching.
We'll see you next time.
See you next time.
Bye bye.